Something important coming up. It's called the Family Caregiver Conference, a conference for families and friends caring for an aged loved one. Dr. Karli Urban is in the studio with me, and she's going to tell us about it because I'm going to guess you've been involved in organizing this thing, right?
You are correct. You are correct.
Nice of you to show up today and to talk about this. You were telling me off the air, I don't remember the first one, but this is your second one.
This will be our second year. Our first year was a great success. We had about 100 people attend, and so we are thrilled to have a second year of the conference.
Well, I think a second year, after it had gone, maybe this is going to be an opportunity for people to say, okay, I know what's happening now, and I'll show up. If you were going to say who would be the audience that you're trying to appeal to, who do you want to show up for this?
So this conference is designed for individuals who serve as a caregiver for their loved one. So it's oftentimes they may consider themselves a caregiver for a parent, a spouse, sometimes it's a friend or a neighbor. So it's somebody that we consider an informal caregiver, so not somebody that's paid in that role.
So would these be people that you live in the same home with? Would this be somebody that you know is concerned about the well-being of the loved one? What is your answer?
It can be both. It can be, sometimes you do see individuals who the parent lives with them in the house and they serve as a, 24/7 caregiver. But then you also have individuals that maybe they go and check on their parent once a week and they still have kind of more of a supervisory role kind of at that point. And really this conference is designed for that full spectrum of the role of a caregiver.
How about those who anticipate that they're going to be in this role sometime in the future?
I think one of the best parts about the conference is it gives you information and education on not only what to prepare yourself for, but what things should you be considering in advance. So what resources do you need? What network and supports do you need from that standpoint? And that's our hope, not only to provide education, but to give them some expectations and the resources that they need to be successful.
One of your focuses is geriatrics, is that correct?
That's right.
So what do you think that we are most, what we most overlook in some situations?
Oh, I think one of the most overlooked things, unfortunately, is the stress of being a caregiver. As a physician, you see the patient, you see, you're dealing with the medical side of things. But I also realize as a grandchild, as a parent now myself, there is a lot that goes on behind the scene to making things work. And a lot of times that 15 or 20 minute visit you have is just a snippet of what's really going on and the struggles that may be going on. And so I think that the more we can provide support for those caregivers on how they can care for their loved one, the better we can do. Let's
go through the day then. This is going to come up a week from yesterday. So
Yes.
This is next Thursday.
That's right.
What's the location?
It's at the Stony Creek Hotel and Conference Center here in Columbia, and it's from 10 in the morning until 5 in the evening.
And there is a registration fee. You would ask for folks to register ahead of time and pay their fee.
There is, but we are very fortunate. We received a very generous donation, and we are able to provide a coverage for that amount. So if the $40 is a limiting factor to registration, please let us know, and we can certainly get that taken care of.
I want to go into the details a little bit more in a moment, but when you said about 100 people were there last year, what do you remember of the age group represented? Like, give me an idea of the younger end of those who attended.
That's a great question. So I would say last year, those in attendance ranged from about 45 years in age to individuals in their mid to upper 80s. More females than males, I would say, kind of distribution-wise that we saw. And so it'll be interesting to see in the second year if a similar presentation is there as well.
All right, so next Thursday, 10 to 5, Stony Creek Inn. I've got the schedule ahead of me here. One of the interesting ones is one of the first ones is compassion fatigue.
Yes.
Tell me about that particular session.
So compassion fatigue kind of references this concept of with anybody that serves in a role of caregiving, whether it's for your child or a loved one of any age, there comes a point where you can really fatigue out from that role. So there's the thought of the day-to-day functional part of making sure someone's taken care of, but then there's the emotional part of it too. And you think about compassion fatigue from a standpoint of how do we nurture and support the caregiver role, not just in getting the job done, but having them have the support that they need to do so and keep themselves healthy as well.
And probably get over guilt when they say, I am experiencing compassion fatigue.
Oh, absolutely. One of the great things I think about the conference last year is in part of our closing session, there was a period for about 30 minutes where those in attendance, they were sharing with each other their personal experiences of, I felt so terrible when this happened. And then the next person says, I had that same experience. And I think they all received this feeling of, we're not in this alone. This is a very challenging role to have, but I'm not in it alone. And I think that's a big important part.
One of the first things that happens in the afternoon after lunch and also looking at the exhibits is something called an ethics panel. Tell me about that.
Yes. So Dr. David Mayer, Kevin Craig, and then Nathan Jones will be presenting in that part. And we're going to talk a little bit about what's the difference between capacity and competency. So we're going to talk about some of those legal terms, kind of more referencing, is a patient able to make their own medical decisions? And then Dr. Craig and Nathan Jones are both going to talk about how do we prepare to have our decisions and our wishes made known. So at what point should you think about an advance directive? What are the steps to doing so? And Dr. Craig in particular is going to talk about why is it beneficial to have those conversations early? Why should you have those conversations even in your 40s, 50s, 60s and not have those conversations when you're in the hospital, maybe towards the latter part of your life when there's different factors playing a role in the stress and playing a role in that decision process?
I grin a bit because I had my most recent colonoscopy recently, and as I was getting ready for that, I was asked, did I have an advance directive or anything like that? So they'll make you think of that if you get certain tests.
That's exactly right. And so we're hoping to provide information not only about why is it important, but here are the steps to getting this done. Let's make this as painless as possible.
Yeah. I like this one because Marilyn Rance, I know of her expertise when it comes to long-term care and levels of care. So she'll be leading a 45-minute session also.
Oh, my gosh. She is just, talk about an expert in the field, and we are so lucky to be able to have her present to our group. I think that's going to be a great presentation.
That'll be levels of care and how to choose the right facility for your loved ones. And again, here's another one that I think is interesting. Delirium. What is it?
Yes. So Dr. Dasgupta, who is one of our geriatricians at the university, he did his fellowship with us as well. He's going to talk about delirium, which delirium can be a very scary experience to see your loved one go through. It's basically when they get into this state of acute confusion, usually due to some underlying new factor. And so that's something that if patients and their caregivers don't know what this is, it can be very traumatic for both involved. So we want to just provide some education of what is it, what do we look for, and what are the ways that it's approached, more of an educational side of things.
When you get towards the latter stages of this, you're going to do a lot of focus, it looks like, on mindfulness. And is that for the caregiver, or is that to help the person you are giving care to have mindfulness?
Great question. So honestly, both. One thing that we realized, and this came out of the conference last year, was a lot of these people that serve as caregivers, they say, I can't go out and get my hair done. I can't go out and go to lunch with the girls I used to go out to lunch with one day a month. And so I think a lot of times people realize their needs and their emotional needs are kind of put on the back burner. Our hope with the breakout sessions is to kind of teach a little bit through music therapy or chair yoga or meditation. What are some self-care things that you can do that maybe doesn't require you to find arrangements for your loved one? Or what are some things they can do that may be easier to integrate into their daily life?
Well, I think that one of the things you said a little while ago is one of the benefits of attending something like this is you'll find out that where you thought only I am experiencing this, you'll find that other people are experiencing this.
Exactly right.
It's Family Caregiver Conference. It is August 16th. Still time to sign up.
There is still time to sign up.
And topics, compassion, fatigue, delirium, advanced care planning, how to find the best elder care, and those kinds of issues. So I think it's pretty neat. Anything else you want to tell us about it?
No, we are just thrilled to have it. We have a website that you can go to. It's muhealth.org/caregiver conference, and you'll find the full agenda there. You'll find registration information, but we would love to have you join us. We have a lot of different exhibitors from the community and regionally coming, and so I think it'll be a great conference again this year. Again, it is muhealth.org/caregiver conference. I'll tell you, I didn't remember that at first, so I just looked up a search for MU Health Caregiver Conference, and I got right to it. That's right. Dr. Karli Urban, thank you very much for being here. Thank you.